But Alexandre Lourenço is someone that has been involved in a very important tool that was used by the World Health Organization and was conducted to help decision-making concerning this crisis. Alexandre, can you expand a little bit on this effort that you have been doing, and also how you see that Europe can be doing something useful after this crisis?
Regarding, I just hope that my connection is good. If it is not, I will try to improve it. But I'm anyway. Excuse me if it's not so well. So first of all, what we have been doing, and actually not only as a consultant, but actually the Portuguese Association of Hospital Managers, we started to work closely with the task force that is dealing with the COVID, mostly at the surge of resources for COVID. So we developed with also the Portuguese company Glint surge planning tool that is now being used across the world on helping countries developing the surging planning regarding hospital beds, mostly also considering different levels of severity for moderate cases, for severe cases and acute cases, but what we call ventilators, but also for ECMO and renal replacement therapy. And also the human resources that go with it. So this planning tool is being used. We are improving it continuously together. And in that sense, it has been a great pleasure to work on this important topic. Anyway, what we are now working on, it's not only on the surge planning, it's on the transition phase that we need to go further on, not only to plan the resources that we need for the first wave, but now how to conciliate the response to COVID-19 and also for the other and general healthcare. But let me just focus, please, and what I believe that Europe can deal with the COVID, and at least an overview from my side, what I believe that we can do at European level and what have been done in the last or during the current crisis. First of all, we realize that this is an health and sanitary crisis, and in my opinion, most of the tools that we have at European level, they weren't sufficient. Even in one of the devices that we developed for epidemiological surveillance, that is ECDC, we show that even across Europe we have different policies regarding epidemiological surveillance. And even if you consider the protection of the overall Portuguese, I don't know if someone is with a mic connected making some noise.
We can ask our dear participants to please unmute yourselves, and otherwise we cannot progress in the conversation.
But anyway, at this health issue or sanitary issue, even the mechanisms that we have at the European Union level, they didn't work. So ECDC didn't show and at least convince the countries how to develop epidemiological surveillance. Each country is developing by its own, and even though some recommendations are being followed by member states, ECDC and with the Commission are not having a common surveillance policy across Europe. Even when you consider recommendations, you have seen the case of Sweden, and of course countries have their own own policies. Even in the implementation of policies, in the case of Sweden or Denmark or Netherlands, actually each country developed their own approach, and we didn't have a common approach to COVID-19. Actually, we even had some selfish behaviors in some countries that are producers of PPEs, personal protection equipments, and ventilators like France or Germany, that first of all they stopped exports from their own countries to other countries that were in need, just to comply with their own needs and not considering the common good or the common European goal. The other issue, and actually, even though health is not a common policy, we really didn't show how to do it. Even if you had some good examples, for example, in critical situations where, for example, patients that needed mechanical ventilation, they have been also treated in Germany. So we had seen these small anecdotal examples that show us that there is some goodwill from member states, but at the general view, I think that each country was by themselves. So, in my opinion, we really miss the issue about common security of the European Union, European state. We didn't approach this pandemic as also a security issue for Europe, and that was missing from the European policies. The other issue is that actually we also, and we will see in the future, how we are going to see the economic impact of all this non-European integration at this pandemic level. So we are now more concerned with the downturn of the economy, the European economy, and what will be the measures to deal with the economic issue. But actually, previously, we could avoid this economic impact, and that is occurring mostly because we didn't have a common health policy and a common security policy regarding health. So, in my opinion, and I think that's what we need to discuss further on, is how we can integrate Europe at health policy level more. And I think during this virtual meeting, we can do this discussion.
Absolutely.
How we can really integrate more at European level.
Absolutely, Alexandre. Thank you so much for the presentation.